I mean, what are the margins? The
That's
last
kinda like-
4
You think
years,
his wife's happy
the
though?
last 4 years, the margins for United probably
It's
have
not
gone
last
up.
4 years.
Yeah.
It's 20 years. It's
20
grown
years,
from
yeah. How much?
20 year, actually 15 years, grown from 2% to 20% steadily every year. It's
Yep,
not
and
like
then-
one backtrack.
And how are the denials? Like how much
Exponentially.
denials?
What was Matt telling us
increase?
about the AI denials last night?
He was actually involved in developing AI bot to deny claims.
Yeah, I heard that. Too.
So you heard that. That's
I
not
heard
even
that too.
insider information.
No, yeah,
so
yeah,
why
I
would you
heard
make
that.
an AI bot to automatically deny claims?
Yeah.
That way you don't have to pay people in India or China about $7 to $12 a week to actively deny claims. Like the cost for paying somebody offshores to deny claims was, you can have a significant like increase in revenue if you just have computerized way to deny
And these
claims.
insurance companies, there's lawsuit after lawsuit on these AI claim denial things.
It's not just the AI claim denials.
But like,
every
it's
lawsuit you
multiple, but
look
it's
at
like-
it, every lawsuit you look at it and how many they've lost is actually like, if you're out there and you have any type of semi-reasonable complaints about delay of care, you can just go press a lawsuit and there's a good chance you'll win.
Yeah.
That's just from what I've seen.
Yeah.
And even if it's not a good chance, it's better than the lottery. So go out and sue your insurance company right now.
Yeah, I mean it's pretty damn
He's a
bad.
lawyer. No.
No.
Why do you guys think like this happened?
You push, and you get a result.
Yeah.
No matter what way, like small regards, like whatever way you do it, you keep pushing, you're going to get a result that's very extreme. And I think that's what happened. This is the last way I would expect to see anything like this.
Yeah, let's go into our practice. What does UHC do to us? We've been trying to get be contracted with them for what?
Yeah.
Like I've been in practice like almost 10 years.
What did the bullet say?
Deny.
Oh yeah, I don't know.
A lot of D words.
Yeah.
It's like
they're saying supposedly from the book, and Amazon actually had to stop. They banned all the shirts that they were selling that were coming off the.
I think it was diners, drive-ins, and drive. It's Guide Fieri's.
Well, I honestly
Guide Fieri's like guide through health insurance.
I called Humana just to try to get credentialing the other day.
Yeah.
And they just wouldn't answer my question.
Yeah.
I legit had one question that I was just trying to figure out what I need to do. And they were just going around in circles and then would basically redirect a question towards me that had nothing to do with anything and would basically be like, so you want to do this, this, and that? And I'm like, no, I have one question I want you to answer.
Yeah.
And they just wouldn't answer. And I ended up hanging up.
And
I was like, I'll
you
try
know,
to
with
figure this out
my
myself.
previous partners were talking to Blue Cross Blue Shield on contracts, and they would keep me out of it because I didn't want to put up with the insurance companies, and I wasn't going to let them bully me around because I knew how hard I worked, and they would keep on like, you know, they wanted to pay us under Medicare rates for a lot of the stuff we did. And those guys weren't doing it, but I was like doing it in my practice. And I'm like, no, I don't want to settle for less. Like you guys, and they were just like, they were being so nice that I'm like, fuck these people. Like, who are they? I'm like, and they were just like someone in like their sales team or whatever, physician liaison, bullshit physician liaisons. And I'd be like, I'm not fucking kissing these people's feet. They can go fuck themselves. Like they gotta, they show me the money, then we're gonna fucking sign the contract.
Yeah.
But if they're not gonna,
they pay me for what I'm actually doing.
Yeah,
and not
it's
just
you
taking
live
money in.
you live by Joe
But
Pesci's.
most
live by
physicians-
Joe Pesci's words. Fuck me. No, fuck you.
But I mean, how much was the CEO taking home? I know CEOs are probably
12
taking
to
home
24 a year.
30 million.
more than
He was
24.
over
No,
dude.
the base.
The Banner
No,
Health
I'm just
guy
saying. I'm
was
just saying.
making 26 mil a year.
Base
3 years
base
ago.
He's making like you're number 5 or 6 on a basketball team.
He's probably
And 10
making
million of it's buying his own stocks back.
Yeah. Oh, this is a great Ponzi scheme that nobody's calling a Ponzi. Let me just buy back.
A lot of, the insurance companies just have created a lot of positions for a lot of people that are just making tons of money.
It's not just the insurance companies.
I was surprised it wasn't a physician.
Yeah, it's the whole system.
Yeah, it was.
Could have been, yeah.
What? Okay, let's play this game. Like, who'd you think it was initially?
I thought it was a hired assassin. The guy looked.
Yeah, I did too.
Shoot.
It was
the way he pointed that gun and shot him.
It just had a silencer, so I'm like, oh, that's a hired assassin or a Jason Statham.
Yeah,
there's no way it's anybody else.
Maybe it's his wife's boyfriend, because his wife was like living away from him. So
it's possible.
Well,
it's Luigi. He was smiling.
He did take his mask down. That's a flirt. Luigi might have been the guy. Luigi might have been with his wife.
Yeah.
There's rumor that it was actually Waluigi.
So funny.
Oh God, we're just joking.
Yeah, one of the you're the one joking about it. We're trying to talk about it.
Yeah. Sorry. All right, let's talk.
Yeah. Like how many the patients we see for breast cancer, and like we know no one else in town can take care of them, and we're just trying to get them to the operating room as quick as possible to get the cancer out. And what do they say? Like they call the patient up and send them somewhere else that can't offer what we offer.
You can call to set up a peer-to-peer on their timeline.
Yeah.
And
for them to tell you there's no way in hell.
Oh, this is not a code we've recognized. Yeah. Like, what the fuck are you talking about?
Or they'll tell you,
this is your regular code.
I was with you guys. I mean, I did a peer-to-peer the other day. And the lady was actually nice. But when I was with
they're all really nice now because they got cussed the fuck out for like 5 to 7 years. I'm serious.
Yeah.
Like, they were just like, they have to like back the insurance company's codes and tell you like actual shit that's not there or in your contract, and you're just like, no. So now they're more nice about it. It's like, oh, okay, we approve this code, but this code isn't. But they would just like straight up.
Yeah, they make you fight for it no matter what, though.
And then that's approved, and then
it's like you have to fight for the patient.
Well, you send them your medical records 30 times. I'm like, you don't need my medical records. You have everything from 20 other. You have it from the hospital. You have it from the other 5 people that took care of the patient. I had that
today, dude.
And like, I'm like the 6th person. You just need my op note, and you've received it 4 times.
No, even without the op note,
you don't need anything more.
Today it was peer to peer. Like, why do you think this patient needs this care? It was like, she has breast cancer. It's like, you need to submit more thorough notes. It's like, I gave you my note from my office, and you have notes from the medical oncologist, breast oncologist, saying she has breast cancer. She's going to have to undergo bilateral mastectomies. And you're telling me, like, I need to give you more evidence that she needs breast reconstruction? Like, are you fucking kidding me, dude? Like,
how about the one that told you, like, the patient doesn't get to choose what kind of reconstruction?
Oh, it wasn't just the patient doesn't get to choose. Yeah. That's what they come to. Sometimes they've learned not to. I haven't heard that in a long time.
That's
like
crazy.
A long time. I would say 6 months. But it's just like, okay, you want microsurgery, free flap reconstruction? There's multiple surgeons in network they can choose from.
Yeah, I was with.
And I was just like, oh yeah, and it was on speakerphone. And I was like, who is it? Yeah. Give me the names. Like, don't worry, the names will be provided. I was like, I need to know those names because I'm going to call my patient and tell them your insurance has been denied. You can call this person or that person to get that done and can tell them what I feel about that surgeon. And they gave me, out of everybody in Arizona, Phoenix, the 5th largest city in the U.S., they gave me 2 names. And one guy I see in the hospital and I'm friends with. And he's told me for the last 6 months, he doesn't do free flaps. And the other person hasn't done a single free flap since training.
Yeah.
It's like,
it's on their website though.
Yeah. Yeah. And she
some
just
marketing
kept
firm
repeating that. And I was just like, I told her, and just like, well, just like, I was like, sounds like you got nobody in network to do free flaps for the 5th largest city in the US. And you have 0 repercussions for that. I was like, this is recorded, right? Just make sure this one's recorded.
Yeah, I mean, similar for me, being Oculoplastics, like even coming in, the Blue Cross like automatically just was like, nope, we're not going to put you under contract. We have enough of you, sir.
Well, every one of our insurance companies did that. Our major carriers in Phoenix did that to you. Well, like Aetna did it, right?
Yeah, but that's the thing. There's only 12 oculoplastic surgeons, and probably 5 of them are actually even taking insurance. The other 7 probably took insurance at some point and are
even if all 12 did,
they don't want
probably be.
But there's 12. Yeah. Oh yeah. It's way underserved. It's 4 to 6 months to see someone, so it's a little ridiculous. So that's the barrier of even starting with.
You know what's the messed up part is? Somebody in Canada is watching this, being like, "I can't believe these guys are complaining about this shit. They have it so good." They got 12 oculoplastics in the city? What the fuck?
And then,
they probably got 30, but they work 9 to 2 on Monday, Wednesday, Saturday or something.
I heard it twice today, actually.
And if they operate 2 operations a week, their drugs are cheaper.
I mean, that's just the beginning of the process, right? And that's our frustrations. And I think a part of that frustration comes to the other end of it. For us specifically is luckily we have a good biller, right? But a lot of places, especially academic institutions, I'd say, and I'm just saying that because of what I've experienced personally at Duke, they bill these out, and there's surgeries that may take, 4, 5, 6, 7 hours, and the doctors don't even get reimbursed for it.
Well, their collections,
but collections are like 20%. It varies in different systems.
No, the biggest
20% of what is being billed out is being collected.
Well, they depend on you doing so much volume and without follow-up and appeals to be able, because that's why they deny everything the first time. Because
there's no follow-up.
Absurd percentage of billing companies don't even appeal.
Mm-hmm. Exactly, and they know in a big system like that that's producing so much that the people can't keep up with.
Yeah.
But
and this how is the shit
that,
show.
How is that okay?
How many cases?
This is the shit storm where
okay?
in
That's just insane.
Yeah,
it's like basically a free surgery. You just did something extremely complex. Yeah. Somebody can get a really bad complication from it.
Yeah,
possibly even die from a lot of these surgeries.
They do,
and you don't even get $1 for that.
Well, and like when I was doing like 3,000-4,000 cases a year, and like going through like as soon as you change billing companies, all your previous stuff, like whatever you haven't gotten paid for, and some stuff's like 3 years, 5 years old that you haven't gotten paid for. All that's like completely almost erased.
It's once in a while you'll get something. Dude. It's tough looking at it. Insane. You're just like people like, oh, why don't you do work for people in this community before talking? We've talked about it before going overseas. Like, you know how much free work I've done over here? Yeah. I donated at some points, over 40 hours a week of free work. Yeah. Where it's just running around town, getting things done.
And we just recently, over the past year and a half, stopped doing Medicare, Medicaid. And it for a while, I didn't do it for the business. I did it because that's what I felt like was right. But then I felt like it was coming out of my pocket. Paying nurse practitioners, workers to take care of patients, and then taking care, if they had, bandages and all that stuff. And then you're like, all right, I have 90-day global. I've seen this patient 12 times.
And on top of that, your surgery is underpaid.
Yeah.
Which is nuts.
Well, we're going to pay you less every year after year.
Yeah. And not just that, it's
with inflation.
It's maybe 10% of your hourly value you would get doing a cosmetic procedure.
Yeah.
Right? And on top of that, you have, let's say, 12 to 15 employees. So like this, just talking about like real life private practice, paying 15 employees every hour, and you're getting $1,200 for 3 hours.
Dude, if you don't do it,
how is that like, how's that?
And the thing is, if you don't
possible?
do insurance, you don't need a lot of the supplementary people. Like you could have one person like scheduling, taking the money, everything. But like for insurance, you need someone doing prior auths. You need someone coding. You need someone scheduling. You need someone billing. Like there's all this extra people.
And then two people to follow up on them. And then private companies to do the billing and prior auth.
Yeah.
And you just think about it in the way like minimum wage is raised. Inflation's gone up. Doctors' salaries have basically stayed the same or gone lower.
They've gone lower.
It's lower because of this. Because I mean, Medicare is legit. Like cataract surgery is 10% of what it was 10 years ago.
Dude, if I was
10%,
if I was 22 years ago,
you can't survive. You wouldn't be able to survive in practice.
But they have money to waste on paper, printing denials. And I get so frustrated. I'm like, why do you spend so much money on so much paper to fucking write denials? And like, they send these packet after packet. I'm like, it's such a waste of trees.
I'm comfortable where I am, but if you talk to 23-year-old me when I started med school and was like, dude, you can get like $14 an hour working at Salads to Go, or you can go to med school, I'd be like, it's a fucking toss-up.
It's a toss-up.
It's a toss-up. Well, like $14 an hour.
Yeah. Well, I'm getting contracts tossed at me for side gigs for a quarter of Medicare rates, which is like basically
the VA hospital system. How about the VA hospital?
Yeah.
How messed up is the VA hospital
I mean,
system?
I'm working on a contract there, so
fuck that. Like talk to people what it's like, because there might be some viewers that are fresh out.
They basically have sent me a contract that's fee basis, which means for my work, what they want to pay me. And it's basically, they gave me a quarter of Medicare rates based on RVUs. That's what they say they want to pay me.
So Medicare rates also are the lowest established
rates by far. So they want to pay a quarter and say, okay, the 75% is your overhead. In an oculoplastics practice, usually overhead's 50, 60%. And no one would be able to survive with Medicare rates if you were paying at that level. So let's put it this way. On a certain day, I would do a surgery, let's say a bilateral upper eyelid blepharoplasty. My charge for that surgery they would pay me $150 and say that takes me an hour, which isn't 45 minutes an hour. But at the VA,
you got to drive there. You got to drive there. You drive there.
Back. No, but then you have
just talking procedure time.
You have an operating room. You have an operating room day at the VA. The VA, everything runs slow. So max, I'm going to get like 3 surgeries. I can do an orbital.
Why does the VA run slow? I don't know why.
So max, I get 3 surgeries. If I do complex surgeries, like if you look at the reimbursement, the max I'll even get for those are like $400. So usually at the end of my day, I'll get a max 3 surgeries. And that's me being there from like 7 to 5 o'clock, turning over like crazy. And I end up with $500-$600 for a day as a physician.
Let's go
wait tables. Tables. How many times did we wait tables and make more money?
And waiting tables was fun.
Serve drinks.
It's just crazy.
Serve drinks, have drinks.
So there's just processes in place that are just they don't make sense. But somebody will be like, okay, yeah, that sounds reasonable to me. Coming out, like a doctor coming out if I wasn't in this position.
That's mostly, I really think of VA positions mostly of like physicians who don't give a fuck about anything or about to
just
retire.
have residents and the residents operate.
Yeah, just don't give a fuck. Like
a second-year resident that doesn't even know his left from his right hand.
There's a chance if you told me about like, you can be a VA psychiatrist and that's your route, just shoot for med school and do all this hard stuff. There's a chance I would have taken it. Like, but that sounds
no. When the VA pays on salary and benefits, they actually do. They do take care of physicians at like a going rate.
It's kind of sad the care that people get, because when I was doing a lot of trauma and like, dude, like people like cut their tendons and shit, and I'm like, I fix their tendons in their hand, and like the care's immediate, but like the post-op care fucking sucked, and they're like, no, he has to go to our hand therapist, and I'm like, okay, get him in right away. It would take him 6 weeks to a month to get, or 6 weeks to 2 months to get him in, and like the guy's hands like, and then he blasts through his tendon, and like, you know, he good luck at getting terrible. Are you going to function out of that hand?
That's why
it's usually like
that's why
young
if I ever
guys
got
and
injured
they
on
serve the country and stuff.
And that's why if I ever got injured on the field, I would say, keep me at this. Like, keep me here. It won't get any better.
Yeah, a way to get people fired up in the hospital is start talking about reimbursement and like insurance stuff. And like, I've just kind of gone away from it because everyone gets fired up, and like it like to keep it positive and keep it away from it. You just don't talk about insurance.
Kind of like chuckle it away. Like you just like, hey,
you just work hard and you're like, okay, I'm gonna do what I can. But if you're actually like thinking about the reimbursement as a physician, you'd like all the time, you drive yourself crazy.
Oh yeah, it's just nuts.
Just say I'll work, I'll be fine, and that's it. You know,
worst comes to worst.
Did you guys know, like the Medicare rate for anesthesiologists is the worst rates ever? So when they came up with the Medicare rates for anesthesia, they get paid less than the Medicaid rates. So that's how bad it is. Oh yeah, they get, I think like Medicaid rates per RVU is like $30, and they get like 21 for Medicare. So it's like, you know,
21 an hour.
So for people,
21 per RVU.
So for people who don't like recognize how important that is,
that's less than a plumber, $80 an hour.
Yeah, but every procedure you need anesthesia to be put under. Anytime you put under, and this is like clipping away at a critical point of your care.
Well, the other thing is like Blue Cross Blue Shield was just about to instate this. Was it in New York or Maryland? Where was it?
I don't know.
It was somewhere in the East Coast. They were about to instate.
Just like barely got to the end of the sentence. It was just like, yeah, I seen this coming.
Well, they were about to instate, like, if the cases take longer than they're supposed to, we're not going to pay the anesthesia past a certain amount. It's a set limit.
It's like a 2.5 hours for this procedure, 30 minutes for that procedure.
Which that's probably good for, like, if you're going towards a one healthcare, like for all type of thing, because one thing's going to happen. Anesthesia is going to be like, that case is canceled. That guy's obese. He has coronary artery disease.
Way less
case
cases.
is going to take 6 hours, and it should only take, I'm only going to get paid for 3.
Way less cases.
Or he shuts off anesthesia after 3 hours, see what the surgeon
Which
can do.
one's the better outcome? Yeah, that might happen.
Yeah, don't take care of the patient.
Another
But this kid saved that. This kid saved that. This kid's shooting of the CEO of UHC made BCBS retract back on it, which, you know, who's going to take longer? And the other thing is, like, who's going to work with surgeons that are going to take longer? Too. That's going to be like,
or like you said earlier today, more complicated patients. Who wants to take on the risk? More complicated patients. Like you're going to like deny
because they'll start with anesthesia and then it's going to go to the surgeon.
Or it doesn't even have to. Like you have no option. Go ahead. Like we have an anesthesia shortage already. Like what's it? 3,000 in the country or 5,000?
Yeah, I think by 2026 these. No, it's even higher.
It's like 3,000 now.
Yeah.
And then get more anesthesiologists to say no to you. So this is a way to like clip away at costs, I think. And I think it's directed.
Yeah.
You know what I'm saying? Okay, you're not saying I won't do the surgery.
Yeah.
I won't do anesthesia long enough to do that surgery.
Yeah.
And you can't put the 2 and 2 together. You can't be like, oh, no, that's your insurance company.
It would create a lot of fights in the operator. Like I
don't think so. I think it would just be a lot less cases done.
Yeah.
The fights would be avoided. Like the patients at their, like it's a secondary way to deny surgery.
And, the anesthesia groups are much bigger. So like certain surgeons, like they would be like chopped off. Because like nowadays we have EMR, which records how long people take on average to do certain cases. Yeah. And, sometimes like, I'm like, I never booked that much time for this case, but they take my volume average and they have it. It's always over what I actually take. So
definitely is.
People would definitely just look at it and be like, we're not working with this guy.
Yeah. And I mean, the other thing is like, if say something happens in the OR during a case and you're taking care of a patient and now it's like being pushed to finish a case earlier.
Yeah.
Like that's not the right thing to do, but it's basically compromising patient care.
All right, let's go conspiracy theory route. Do you think Epic is sharing any of the extra data with insurance companies? Epic, largest EMR, things like operative time, everything involved in whatever you put into Epic as data points. Do you think they're sharing it with the insurance companies?
Why would it matter and why?
In any way they can analyze to delineate you with higher risk or lower risk. I personally think insurance companies have enough data to...
Well, the insurance companies are buying out like a lot of these physician groups, so they have inside people already.
No, I know, but like when you get like hard data like that you can
they also
analyze
get that
easily.
data, right? They got to get your op reports, although they say they don't receive it. It is the medical records that they have.
But I think they have more like hard numbers, like down to the vitals and stuff that we
with AI and stuff. They probably have like much more than you could even think of, because they've been inputting, like the hospitals send them op notes and like all these systems are in there.
It's not just op notes. It's like the time stamps, like for like anesthesia during an operative procedure, like all the data points that are put in. Yeah. They have a lot of data points. Right. I don't know. That's my conspiracy theory. Partial. I didn't even explain it.
All right. Another episode of Doctor's Life Podcast. We talked about
Bruce is done talking.
Insurance. It's getting late.
Yeah.
He never gives the exit today. It's like, and that's another episode.
Because he's like, Rod showed up late and started fucking blabbering on.
Yeah. It was a good episode to blabber. Yeah. Sorry.